So Tessa, it's pretty remarkable to have you join the whole project here on the 90S study, and in particular the two areas that you specialise in, the cardiac genes and the recessive disorders. Just asking about the recessive disorders, how common are recessive disorders?
Well, recessive disorders are common, and probably maybe 1 in 300 couples are at risk or have a child with a recessive disorder. And so much of that could be prevented. And now, not everyone would choose to actually prevent having a child with these, because I'm not saying all these children have a disease that is, is a disaster. But it is ill health from the beginning. Does seem a tragedy. Life is tough if you're okay. So trying to avoid this, and it is now possible. We're not going to be able to avoid everything, but it has now come of age. And I think if you do whole genome sequencing, one of the most exciting parts of this is, even if you can't find something now, you can revisit the data. And I think that although the recessive data is now very good, the chances of going back when you've got everything there is the most remarkable thing about this project, because we're not going to look at everything at this precise time, but new diseases are being described on a daily basis, and we can't look at those at the recessive level at the present time because they haven't even been described, but we can go back. And how wonderful is that? How many times can you actually press the button backwards and say, let's read it? It's real Groundhog Day. Every day we can redo
Absolutely.
all this.
So I suppose I see a dominant disorder as a few genes coming in pairs, and if you take my two fingers, when I lift one knuckle up, that's going to be having a variant in a gene which might cause a problem. So if you have a dominant gene, if you have a variant in one of the pair, you will get that disorder. Whereas if it's a recessive gene, you've got to have the change in both of the pair. So what happens, isn't it, is that many people carry a recessive disorder. They don't get it because it's only one of the pair and it's a recessive gene. But if they marry somebody who's got the same recessive, such as something like cystic fibrosis, they'll have 1 in 4 of their children will have cystic fibrosis, and 2 out of 4 will be carriers, and 1 won't have it. So this is the type of situation you probably deal with.
Yes, I think you shouldn't forget about the X-linked disorders as well, because of course
Can you explain about X-linked?
Yeah, so we know that poor men only have 1 X chromosome, and then they have this tiddly little Y chromosome, which lacks a lot of what women have, and so they miss out on a spare copy of a lot of genes. So if women are carrying a mistake on one of their X chromosomes, if they pass that on to a boy, he doesn't have a backup. And so when you're talking about carrier testing, you're not only just talking about the autosomal recessives, those involving the chromosomes where we all have 2 copies, but we're also talking about the X-linked genes. So, the carrier testing, certainly if you test a woman, you will be looking at both.
Could you name some X-linked recessive disorders?
Well, of course, the one that I think most people think about is Duchenne muscular dystrophy, present in 1 in 3,000 boys, which remains an absolutely devastating disorder where these children become wheelchair-bound by about the age of 9 and die normally in their early 20s from respiratory failure. It's a devastating disease. So if we can prevent diseases like that, and treatment, yes, they're doing huge amount of research to try and develop treatments for these diseases, but actually it's a long way before people are going to have a normal life with these diseases. So Duchenne muscular dystrophy would have to be my top. Then, of course, there's haemophilia, and everybody knows about factor VIII and the disease that Queen Victoria passed on to the whole of Europe. Although there is good treatment for it, there are still multiple problems with haemophilia. And even if we're looking in the future at gene therapies, at the moment, if you can truly prevent these being passed on, you're doing a fantastic service, I feel, for individuals.
So Tessa, having sort of thought that whole discussion through about recessive disorders, and 1 in 300 births may be a recessive disorder, and with having the capability to stop that if you've got a particularly nasty recessive disorder, something whereby the child's going to survive very little time and is severely brain injured and that type of thing. How do you actually do that? I believe it's called prenatal genetic diagnosis. Could you explain?
Well, we have two ways of going forward with this at the moment, and more I'm sure will be developed in the not too distant future. So at the moment you can either choose a standard prenatal diagnosis where you have a test early on in the pregnancy where you take a small bite of the placenta and then you don't continue the pregnancy. Now, for a lot of people that is really not an acceptable option, but for those people we now have something called pre-implantation genetic diagnosis, and that is if you know about a disease in advance, you can select embryos which can be tested at day 5. So the woman, yes, she has to go through IVF, maybe not the most exciting way of conception, but still, for a lifelong potential of good health, each egg is then injected with a single sperm from her partner. These are grown for 5 days. They are then tested for the presence of the disease, and only an unaffected embryo would be reimplanted. So it's a very exciting technology and actually very effective and very, very accurate. So it's certainly something that a lot of people have taken advantage of already, and there are over 600 diseases that have been approved. And of course, avoiding charlatans in the field is extremely important. We're very lucky in this country having the Human Embryology and Fertilisation Authority, which keep checks and balances. So I don't think we are in a position where we are going to get ourselves testing for irrelevant reasons.
So with the Human Fertilisation and Embryo Authority, often abbreviated the HFEA, having these wise, ethical decisions to say whether for a baby living with such a disorder it's such a difficult life that they think that it's acceptable to do prenatal genetic diagnosis. Do you see a time coming where all couples may be offered recessive carrier screening?
Yes, I think when you are looking at screening now by ultrasound in pregnancy, I think one of the most important things that people have choice and they don't feel they have to have this, and I think there is a lot of people who will choose not to have it. But I think for those that would value this investigation, as the price comes down, I certainly hope that it can be widely available to the majority of people who would choose this sort of pre-testing, which I think would be a fantastic.
So I think it's just a simple blood test, isn't it? And you can do about 400 recessive carrier disorders in a blood test for, say, both partners, and check that they don't have a match for something like, say, cystic fibrosis. And if they do, then they can think about what they want to make a decision. And obviously many children with cystic fibrosis do incredibly well now, but there are obviously much more severe disorders.
There's some absolutely tragic disorder, and I've only just seen one today where the woman's just having her second baby with a very, very severe brain disorder, for where the child is not going to survive. So, that would have been, if we could have picked it up beforehand, that has to be a better option. I feel very strongly that it's a much better option than just waiting until late on in the pregnancy or after birth you find out about these tragic events.
Yeah. I think it's probably about £1,000 for each partner to do recessive.
Oh, much less. It's less. It's about £600 pounds per person. So it's still expensive. But it's an awful lot cheaper than a holiday, especially with COVID. With all those COVID tests, you've almost got something for life when you do this. So I think it's well worthwhile.
It's such a sensitive subject, isn't it, when for somebody in your position as an authority in this field, seeing so many families with so many tragedies.
Yes, and I think there is a huge issue when people say to you, oh, well, you're trying to provide, create a perfect world where disease is removed. We're never going to remove disease, and we're talking about very, very serious illnesses. We are not talking about intelligence, we are not talking about physical attributes, we're talking about health. And actually that's what we are all involved in, is actually trying to have healthy patients. And what better way of doing that than this?
Yeah, thank you. And I expect many families who've had a child with a recessive disorder are very grateful when they come to you to have some feelings of security for their future.
I think as you go into another pregnancy, knowing that you can be reassured that the baby is unaffected because you've had pre-implantation genetic diagnosis, or you've chosen to have standard prenatal diagnosis, it allows people to have healthy families. People just did not go on to have a further child in the past because it was such a terrifying option.
Well, thank you very much. It's exciting.